How can allergic reactions to contrast dye be avoided in CF scans? Imagine needing a scan to check your lungs for cystic fibrosis, but worried about allergic reactions to the dye used in imaging. That's a common concern, but there are proven ways to reduce the risk. The first step is to review your allergy history thoroughly. If you've had a mild reaction before, your risk of a serious reaction is low. But if you've experienced moderate or severe reactions, your healthcare team will take extra precautions. They might suggest premedication with medications like corticosteroids and antihistamines. Usually, corticosteroids are taken starting 12 hours before the scan, and antihistamines just before the contrast is given. If the scan is urgent, an accelerated regimen can be used, starting about 5 hours prior. These medications help lower the chance of a reaction but don't completely eliminate it. Another important step is skin testing. This involves exposing you to small amounts of the contrast agent under controlled conditions to see if you react. If you've had a severe reaction before, your doctor might recommend avoiding the original contrast agent altogether. Instead, they might test and use an alternative that you tolerate well. This process, called drug provocation testing, confirms safe options before the actual scan. Modern contrast agents are much safer than older ones. Low-osmolar, nonionic iodinated contrast media are now standard because they cause fewer allergic reactions. These are preferred for cystic fibrosis patients to minimize risks. For some patients, especially those with known allergies, using gadolinium-based agents for MRI scans can be an option. Gadolinium has a lower rate of allergic reactions, but it's important to note that it's used mainly in MRI, which is less common for lung imaging in CF. Gadolinium also has specific risks for people with kidney issues, so your doctor will evaluate if it's suitable for you. If you have a history of severe reactions, your imaging should be done at a facility equipped to handle emergencies like anaphylaxis. Always inform your healthcare team about your allergy history before the procedure. During the scan, medical staff will monitor you closely to catch any signs of a reaction early and treat it promptly. In some cases, alternative imaging methods can be considered. For example, MRI scans with gadolinium contrast may be used instead of CORT scans if the risk of allergy is high. However, the choice depends on what part of your body needs imaging and your overall health. Hydration before and after the scan can also help reduce the risk of contrast-related issues, especially if you're using contrast agents that can affect your kidneys. Overall, avoiding allergic reactions involves a personalized approach. Your healthcare provider will assess your allergy history, possibly perform skin testing, choose the safest contrast agent, and ensure proper monitoring. Always discuss your concerns and medical history with your doctor before any imaging that involves contrast dye. This way, you can get the information you need safely and confidently, knowing that your health is the top priority.